headache. Rajan. And why the headache will be a separate lecture. Although it's the last lecture, but it's not the least lecture. It's an important one. Because the headache as a presenting symptom could be the presentation of many problems. Some of these problems are simple, but some of the problems are serious, with high consequences. Now, in this lecture, we try to show the light on certain points to differentiate between different types of headache due to different etiology, the simplest one and the serious one, and how you differentiate. Because you, as a doctor, young doctor, when you graduate, inshallah, حتكون, for example, you are in the casualty, A&E, or you are in the clinic, في العيادات. And high percentage of people came with these symptoms. So you are the first station, the first filter, the first doctor to see this patient are you. And according to your decisions, the consequences will be planned. حسب قرارك. And if you have the right decisions, you have the right answer. And you will save the patient and protect yourself. But if you have the wrong decisions, you will have a bad consequences on the patient and on yourself. You have to differentiate which is the serious one. يمكن واحد منكم يحكي خلاص حتى to avoid the problem, I will avoid and I will admit all the patients with headache to the hospital. This is impossible because the capacity of the hospital is limited. If you admit every patient with a headache to the hospital, you fill the bed of the hospital within the first hour. And then there might be a serious patient came and there is no vacancy. And this is a problem. So your decision to how and who to admit depend on scientific criteria and logical criteria. You admit this patient with headache because he has so and so and so and so. And to treat the patient as an outpatient because of certain facts. And in this lecture, we'll overview these logical, simple facts. Now, to start with, a headache as a symptom, it accounts for about 1 to 2% or more of emergency counseling department. And also, so you have a lot of patients for evaluation. This is the important point. Your evaluation تعتمد على كل شيء. تعتمد عليك. You evaluate which patient should be needed to be admitted and which patient should be not on scientific basis. On scientific basis. So you have to attend a quick screening to differentiate which patient should be admitted and which patient not. And also, in the medical office, that is the clinic, more than 4%. كلكم لا تروحون للعيادات وتشوفون الازدحامات الموجودة في الميديكال كلينيك. وشوف majority, especially as in winter time. Viral infection is coming. Flu-like illness is coming. But you have to differentiate which headache which is caused by simple infection or which headache is caused by a serious cause. Now, to understand how headache generated, the headache usually is caused by, number one, traction, displacement, and inflammation or distension of the pain-sensitive structure in the head or in the neck. This is the basic explanation how headache originated. And also, we have other mechanism of the protections of headache. We will discuss it at the end of the lecture. Now, what are the intracranial sensitive, pain sensitive? For example, we have the venous sinuses, or the arteries, meningeal arteries, anterior amidopharyngeal arteries, dura, matter at the base of the skull, trigeminal nerve, and the 9th and 10th nerve, internal carotid artery, circle of Willis, periaqueductal gray matter, and sensory nuclei in the thalamus. All these are pain-sensitive structures. Now, قبل السؤال دائما تنسألون به, how you classified the headache? Generally, we classify the headache or the causes of headache into a primary headache and secondary headache. The primary headache, we have examples like migraine or tension headache or trigeminal or daily headache. The secondary headache means it is a preferred headache, means that the problem is not in the head, in structure nearby the head, and the pain is radiated to the head. So we have referral headache from structures like eye. كثير من الناس عندهم مشاكل in the vision, it causes a headache. يمكن تتصلح proper spectacles, or a problem with the nose and sinuses, or cervical spine, especially in elderly, cervical spondylosis, causing spasm of the leg muscles and pain. Or we have a headache called medication overuse. هنتكلم عليها بعدين آخر شيء. يسموه rebound headache. Also, we should not forget that trauma to the head and neck causes a headache. And also, we have a special entity called vascular disorders, like subarachnoid hemorrhage. هذا راح تاخذوه بالنيوروسيرجن or ABM. But we have entity which is called vasculitis. Vasculitis, which is very, very important. Inflammation of the blood vessel, especially the temporal arteries. Temporal artery. ولهذا يسموها temporal arthritis or giant cell arthritis. وهذا راح ناخذه in detail because this type of headache is very serious one. If not diagnosed easy. And of course, we know that the headache could be caused by changes in the pressure, intracranial pressure, high or low, tumor, brain tumor, and infection. Infection on the CNS, meningitis encephalitis. هذا أخذناها المحاضرة قبلها. Serious problem. لازم تعرف المريض اللي جاي عنده headache. Is the patient have meningitis or encephalitis? By localizing the meningeal sac. Or other infection, systemic infection. So this is a categorization of classifications of the headache. Now the temporal arthritis is a very serious one and indicates inflammation of the temporal artery. This is the temporal artery and it is inflammation of the temporal artery. And usually it is connective tissue problem. Inflammation inside the temporal artery. So the features could have a general features and a localized features. Usually in middle age and elderly, and the patient have symptoms. And the first symptom is the headache. Generalized tiredness, sometimes fever. And the patient could localize the headache on the right side or left side. She put her fingers on the side of the pain. And also associated with tenderness. When you palpate, there is tenderness. This is early symptoms. But if this symptom passed unnoticed or misdiagnosed, because branch of with the temporal artery, we have branch of the artery goes to the eye. So if there's inflammation of the ophthalmic artery, that leads to optic disc ischemia and loss of vision and blindness. شوف هنا النقطة المهمة blindness. Now, for purpose of diagnosis or classification, okay, so the patient, we can diagnose patient with giant cell or temporal artery if it has at least 3 out of the 5 criteria. شو هي؟ Number 1, age and the disease of onset, 50 and above. 50. 2, new onset headache. راح نتكلم بعدين على red flag in headache. And one of the red flag in headache is the new onset headache. ما كان عنده headache بالأول. New onset headache. And 3, there is temporal artery abnormality. There is a thread-like. The artery is a thread-like, thickened. So temporal artery abnormality. If those 3 features are present, then you suspect the condition. So we send investigation, for example, the ESR, elevated erythrocyte sedimentation rate. ما تاخذ ساعة من عندك. And usually is above 50 millimeter per hour. Elevated. That's number 4. And for definite 100% diagnosis is we do abnormal artery biopsy. But we should not forget, or we should not wait until the result of the biopsy. When the clinical suspicion is high, you have to treat the patient as soon as possible, immediately, to save the patient vision. To save the patient vision. The abnormality of the temporal artery biopsy, the biopsy specimen show sign of vasculitis, characterized by infiltration of the wall of the blood vessel by mononuclear cell infiltration. The giant cell, multinucleated giant cell, multinucleated giant cell. And also, you find the granulomatous inflammation. Granulomatous inflammation. Okay. So if you have high suspicions by the clinical diagnosis, these 3 steps, you have to treat it. Don't wait for the biopsy. Biopsy is for confirmation. Now, this is the giant cell arteritis or temporal arteritis. This is the blood vessel. This is the common carotid artery. This is the external carotid artery. And this is the temporal artery, superficial temporal artery. Superficial temporal artery. Okay? And there's inflammation in that artery. And there is systemic sign of inflammation. Systemic sign of inflammation. يعني المريضة commonly she has systemic symptoms like fatigue, tiredness, or fever, or weight loss. Commonly 15 years and above, commonly in women. Sometimes associated with polymyalgia rheumatica. هذا polymyalgia rheumatica هو involvement of different joint at different time, shifting pain. And there is temporal arteritis. Sometimes the complication involves the aortic aneurysm, or sometimes stroke, or blindness. Because there is the branch of the artery goes to the eye, so there will be the optic atrophy and vision loss. When you examine, look, you palpate, this is the green one, there is raised tender temporal artery, raised tender temporal artery. And sometimes you have pain at the jaw, because there's branches at the jaw. Or sometimes branches of the lung, of the tongue, leading to tongue necrosis. So, giant cell arteritis caused by inflammations of the artery, typically the age of 50 and above, and causing the head pain, jaw pain, vision problem, and closely related to the polymyalgia rheumatica. This is the arteries and this is the temporal artery. Temporal artery. And this is the ophthalmic branch. Ophthalmic branch. Sometimes the inflammation in the temporal artery and in the ophthalmic artery. When the ophthalmic artery is involved, that leads to ischemia to the optic disc. And finally lead to optic neuritis and optic atrophy and blindness if not diagnosed. Also, there are other branch, goes for example, lingual, tongue, or facial. This is, look, this is the temporal artery, thread-like, thread-like. If it is too late, you not diagnose, there is ischemia of the optic disc leading to optic atrophy. Optic atrophy. This is late complication. Now, if you suspect this, generally, you have to go urgent referral to the hospital. And usually, if your suspicion is very high, on initial evaluation, you start with steroids, high dose steroids, prednisolone. Now the management, if there is features of temporal arthritis and the vision, no visual symptom, you start with the oral prednisolone, 40 to 60. But when the vision, there is visual loss, you give parenteral methylprednisolone 1 gram IV, methylprednisolone for 3 days. So steroid is a life-saving. Save the eye, save the vision immediately. And it is, you treat. And also it is diagnostic. Because after steroid, immediately the patient will feel better. So it is diagnostic. So it is therapeutic as well as diagnostic. And now, role of steroid is therapeutic. You treat the condition, and diagnostic, because there is quick improvement in the pain and tenderness immediately. فإذا أنت بالطوارئ بالعيادات إذا كان عنده واحد عنده headache, this is the first time he has a headache, elderly and head and tenderness on the temporal side, right or left, put your hand and palpate for the temporal artery. If you find there is temporal artery palpated, you send for ESR. It will take 1 hour. Will come the result. And immediately you start the steroid. Okay. So that is the temporal arthritis or giant cell arthritis. Okay. This is one type of secondary type of headache. Now, they found that sometimes the localization of the headache could give you a clue of possible underlying problem. For example, a patient has sinus problem. The pain is behind the brow bone here, there. This is the brow bone here. Or at the cheek. Depend on which sinus is involved. Whether the maxillary sinus or frontal sinus. On the other hand, if somebody have a cluster type of headache, هنتكلم عليه بعدين, the pain is in and around the eye. In and around the eye. راح نتكلم عليه in detail. On the other hand, the patient with tension headache, the pain is like band-like, squeezing the head. وهذا ردت أبو أحكي عليه. يعني التنشن headache من اسمه patient having tension, psychological tension. With tension, there's a chronic contractions of the scalp muscle around the head.
So the scalp muscle is contracted. So it will act like a band-like around the head. كأنه جايب شيء وعامل لك band around the head. And this band will cause the pain. Causing the pain. And this is a band-like, and it is squeezing in character. كأنه بيحصل البand. Squeezing. This is tension headache. On the other hand, in migraine headache, usually the pain on one side, but could be on both sides, associated with other symptoms like nausea and visual changes. ده على التايب of the migraine. راح نتكلم عليه بعدين. Okay? And this is migraine headache. اكو red flags in headache. هاي تنحفظ. حتى مو بس تنحفظ، حتى بعدين صار من السرور بالامتياز او بالهذا تطبعها تخليها على ورقه جلستنها خليها بجيب المريول جيب الوايت كوت مالك تعملها تشيك ليست. The red flag in headache. Number one, the patient said it is the worst headache of my life. الدكتور انا صحيح عندي headache بس مثل هذا الهيدك ما بيشايفها. blinding headache بيعميني blinding headache. أو she said this is a new onset headache. هذا أول مرة يصير عندي هذا الهيدك. It's a red flag. أو number three, change in the character of the headache. يقول لك دكتور أنا عندي headache يصير ويروح ويرجع بس هالمرة this time the character of the pain is different. هو حاس بالأمر. Or the headache awaken the patient from sleep. red flag. البين اللي يمنع البيشنت من sleep and waking him up. This is a red flag. Or could be associated with focal symptoms or fever. إذا headache with fever هذا red flag sign to associate to exclude infection, meningitis or encephalitis. Or the headache is worsening with bending, lying down, coughing or sneezing. Indicate changes in the intracranial pressure. Or the headache in immunocompromised patient. Whatever the reason, أكو immunocompromised disease. لأن ذولا they are liable for infection, liable for meningitis or encephalitis. And lastly, patient with history of cancer. ليش؟ لأنهم could have a primary cancer in the chest or abdomen and the secondary metastasis to the cerebral cortex. So 1, 2, 3, 4, 5, 6, 7, 8. I didn't have all. Okay. And immediately every patient would have to go. شوفوا العيادات بها blood pressure machine وبها ophthalmoscope. And you examine for a normal fundus. This is a normal fundus. This is optic disc, pink in color, and this is the optic cup, and the border of the optic disc is very clear, and there are blood vessels. Like in this one, the border is blurred, and the blood vessels are congested. Blood vessels are congested, and that indicates raised intracranial pressure. And in this is more serious. It is a papal edema. All the optic disc is blurred by edema. And there is hypertension especially. There is hemorrhage. Hypertensive retinopathy. Hemorrhage. This is hemorrhage. And there is exudate. Especially exudate. Could be diabetic. But these are abnormal and this is normal. إذا لازم يصير عندك عادة دائما كل هدك تعمل فندسكوبي، ما تاخذ مندل بيو بس you avoid a lot of problem. Okay. We will take an example of a primary headache. هسه حكينا على giant cell arthritis as a secondary headache. ناخذ example of primary headache, migraine. Migraine, it is very common disease. The prevalence 12%. مو بس هاي. More than 90% before the age of 40. أغلبهم young, productive, شغالين, طلاب. Then more than 90% 40. And we have two types of migraine. We have type of migraine, begins with visual problem like a blurring of the vision, one side or two sides, or zigzag movement, or star in front of. Okay? This is the beginning. ليش؟ لأنه pathophysiology of migraine is due to abnormality in the blood vessels. And it passes in two stages. The first stage is vasospasm. هنا يصير visual symptom because of ischemia. Or sometimes the visual symptom we could have a neurological symptoms. وهي تقريبا 15 to 20% of patients. هذا يسموه migraine with aura or classical migraine. إذن هذا هو الفيرست تايب. classical migraine. إذا قلنا لك شو هو الكلاسيكال migraine؟ هو هذا المايجرين اللي start with aura. قبل لا يبدي الهدك تبدي visual symptom or neurological symptom. Migraine with aura. The remaining type, second type, more than 80%, most cases no aura, ما في aura. This is called migraine without aura أو يسمونه common migraine. إذا نفرق بين common migraine والclassical migraine. Classical migraine في aura. common migraine ما في aura. انتباه، هذا classification، هذا واحد. Now what are the diagnostic criteria? We have diagnostic criteria. Number one, at least the patient have 5 attacks. 5 attacks fulfilling the criteria from B to D. شو هو B to D? B, headache attacks lasting 4 to 72 hours if untreated or unsuccessfully treated. هذا number one. B. C, headache has at least 2 of the following. 2. شيء unilateral headache, pulsating quality, pulsating. بينما التنشن هذيك band like. هذا لا pulsating. ليش pulsating؟ لأنه vascular headache. ليش pulsating؟ نرجع مرة ثانية على الميكانيزم. احنا الميكانيزم vasospasm or vasodilatation. بالvasospasm تصير الأورا. بالvasodilatation, dilatation of the blood vessel, brushing on the centers, pain sensation, and that lead to pain, which is pulsating pain. Pulsating. حس يقول لك what is the character؟ يقول لك هيك بينبض، شو بينبض عندي؟ Okay؟ طب pulsating quality. And also the severity between moderate to severe pain intensity. And the pain aggravated, there is aggravation or causing avoidance of routine physical activity like walking or climbing. ولهذا من السر عند المريض ومن يعرف usual الروتين مالته يوقف. وبعض الأحيان so severe prevent him to do that. I see. D, during the headache, at least one of the following: nausea or vomiting, photophobia or phonophobia. Okay? And E, not attributed to another disorder. هاي الحفظ and the diagnosis. المانجمنت اكو عندنا prophylactic وعندنا abortive treatment. البروفيلاكتيك شو وقت نستعملها؟ اذا كانت الاتاك تو فريكوينت، بالاسبوع مره او كل يومين مره او بالشهر مره، it will interfere with the usual working facilities، يأثر على شغله وعلى عمله. اذا كان طالب ما يقدر يدرس، فهنا نحتاج الى بروفيلاكسيس، نعطيه علاج وتيك ات continuously. عنده هدك او ما عنده هدك يستعمله على طول حتى لا يصير عنده acute attack of headache. البروفيلاكتيك ماني دراجز like the beta blockers، بروبانالول اندرال ياخذ ديلي 10 twice a day 20 ملغ twice a day بروبانالول. بعض الاحيان not enough we add Topamax, or sometimes we use antidepressant like amitriptyline. ليش؟ لأن amitriptyline making decrease the tension. Okay. هاي prophylaxis continuous. إذا جت الأتاك هو المريض بيعرف. Number 1, we go to have a rest, especially in a dark room. كلكم تعرفون كل اللي عنده مايجرين يعرف يروح مكان ظلمه، غرفه ظلمه، لانه اللايت is irritating and causing more pain. So you go to have a rest in a dark room and go to sleep, because if you go to sleep, when he wake up he will feel better. Besides, we use drug for the acute treatment, like acute analgesia, like ibuprofen. But sometimes we use sumatriptan or ergot preparation. We use it. This is for abortive attack. نجي على شيء الآخر اللي هو التنشن هيديك. الكاركتر مالت او الدايجنوسيس هنا at least 10 episode، مو 5 لا 10، fulfilling the criteria from B to D. شو هي؟ B, headache lasting from 30 minutes to up to 7 days, and the headache has at least 2 of the following pain character. Number 1, bilateral location, mild to moderate intensity. mild بينما كان المايجرين moderate to severe، now mild to moderate intensity. هنا يقول may inhibit but does not prohibit activity. شو نقصد فيها؟ يعني بيأثر على الشغل أو العمل، بس ما يمنع إنه ما يعمل العمل لأنه متعلم عليه تنشن عليه. أوكي؟ inhibit but don't prohibit. الكاركتر هاي مهمة، pressing، tightness لأنه band like، and non-pulsatile. وهاي النقطة اللي تفرق بين tension headache والmigraine. non-pulsatile. And no aggravation while climbing stairs or similar routine physical activity. And D, both of the following: no nausea or vomiting, and sometimes anorexia, no more than one photophobia or phonophobia, not attributed to other cause. هذا التنشن. نجي على تيرم اسمه كلاستر هيديك. من اسمه؟ كلاستر هيديك. شو معنى الكلاستر؟ معنى يجي على شكل هجمات، والهجمات هاي متتالية. كلاستر، هجمة بعد هجمة، هجمة بعد هجمة، تعتمد على السيفيريتي. كيف نعمل دايجنوسيس؟ A, at least 5 attack fulfilling criteria B to D. B, severe or very severe أكثر من migraine, unilateral or orbital or supraorbital or temporal pain. حول العين، داخل العين، فوق العين or temporal pain. Lasting from 15 to 180 minutes if untreated. هذا واحد. C, headache is accompanied by at least one of the following. وهي تنحفظ. Number 1, with the headache on the same side, ipsilateral conjunctival injections and lacrimation. يصير congestion بالconjunctiva، يصير red ومع lacrimation دموع. واحد. Ipsilateral nasal congestion or rhinorrhea, congestion in the nose. 3. Ipsilateral eyelid edema. 4. Ipsilateral forehead and facial sweating. 5. Ipsilateral meiosis or ptosis. 6. A sense of restlessness and agitation because of the pain. Patient is restless and agitated. So this is the patient have pain around the eye, one side, or at the temporal side, and he's very restless. Look, he has the pain there. Conjunctiva is very red, congested, and there is tearing. The nose is very congested, and nasal. The pupil is small, and sometimes there is swollen of the eye, and droppy eye, ptosis. هذا cluster يجي in attack. Okay. Look, congested of the eye, meiosis, even edema of the eye, very severe disease. So, the major clinical criteria for cluster headache, predominantly number 1, found in male more than female. Severe or very severe pain. A duration short, 15 to 150 minutes. Average 45 to 60 minutes. وهاي مهمة clustering of attack. يجي مرة باليوم وبعض الأحيان 10 per day. أما مرة أو مرتين أو 3 وحتى 10 مرات باليوم. يجي ويروح. And there is unilateral pain either in the orbit or supraorbital or temporal. And the headache is accompanied by, as I said, ipsilateral tearing, congestion, ipsilateral nasal congestion, ipsilateral eyelid swelling, ipsilateral forehead facial sweating, and meiosis and ptosis. And the patient is extremely restless and agitated. And the attack have frequency from 1 every day to 8 or 10 per day, and not attributed to another cause, disorder. And the treatment of the acute attack, the patients have rest, complete rest, and giving a drug like samatriptan. And for the prevention, sometimes we use gabapentin. Okay. We have also one of the primary headache is the trigeminal neuralgia. In many patients, in many instances, the trigeminal nerve, fifth cranial nerve, the root of the nerve are in close relation to vascular structure. And that vascular structure will press on the nerve root. So there is microvascular compression. And this microvascular compression leads to demyelination of the nerve root. Is believed to be the cause. Usually also involve the branches V2 and V3. Look, this is normally, this is the trigeminal nerve, this is the root of the trigeminal nerve, and these are the branches. There's blood vessels here, but the blood vessels is far away from the root. This is normal. But abnormally, sometimes the blood vessel come near the root and compress the root, leading to compression, leading to compression and leading later on to demyelination. The character of the pain, it is lightening pain momentarily. يقول لك دكتور عندي لمعة lightening كأنه مصاب بلمعة. Look, lightening كأنه شوف كأنه مصاب صاعقة. Lightening momentarily lightening. And the time more than 1 second and maximum 2 minutes. But there are trigger zones. انتبهوا شباب انتبهوا شباب انتبهوا يا بنات. Trigger zones. These trigger zones about the cheek, nose, mouth, and could be stimulated by touch. ولهذا بنقول للمريض where is the pain? He said this side. He will never touch it لأنه if he touch he will start the pain. فيأشر عليه من بعيد. Touch, cold weather, cold air, especially ذولا cold wind. مش اللي يطلع الصبح المسجد الدنيا برد يشوف لازم بلب حاله. Or sometimes talking or chewing can precipitate the attacks. كملاحظة number 5, if it is in the young ودائما هذا بالأم, if it is in the young and it is bilateral symptoms associated with abnormal neuroexam, you have to exclude MS or brain stem tumor. لكن usually هو بالألبر. lightening pain. شوف هذا كله بشر كأنه بيصعب. And usually the management is during the attack or before the attack, sometimes خلال maintenance treatment. We use Tigritol, carbamazepine, or anticonvulsant. بس شو يعمل؟ It will take the sharp edge of the pain. لأنه sharp edge كأنه حافة سكين. فهو ياخذ الشارب edge of the pain. فالبين يصير dull. فيمكن يقدر يستعمل بعدين usual pain killer بيرتاح عليه. بالتيجرتول. But sometimes there are resistant cases. And surgery could be indicated. ما ندخل تفاصيل. Last but not the least, اكو headache يسمونه medication overuse. شو نقصد medication overuse؟ في ناس عندها عادة دائما تستعمل pain killer. كرونيك دائما اللي بجيبته بنادول وات ايفر بروفين وات ايفر بين كيلر على طول. اذا شاف جيبته ما فيها بين كيلر على طول يروح للصيدليه. من يخلي البين كيلر تابلت بجيبه يرتاح وياخذ منها. It is characterized by the following. The headache, okay, more than could be 15 days per month. كثير تقريبا نص الشهر. Associated with regular overuse of painkiller tablets for more than 3 months. And that's for more than 3 months for either acute or symptomatic treatment. And these drugs are varieties of drugs. Could be ergot preparation, triptan, sometimes opiate, or combination of analgesia medication. يستعملها more than 10 days a month on regular basis for 3 months. إذا يستعمل الدواء هذا drug for 10 days per month for over than 3 months. Could be simple analgesia or combination of drug, ergot, tryptamine, or analgesia. Okay, sometimes 10 or 15 days per month or regular basis for more than 3 months. So this is without overuse, ما عنده overuse بس شنو chronic use of any single class alone. لاحظوا انه الهيدك، وهي نقطة مهمة، the headache may develop، انتبهوا، headache may develop or markedly worsening during the medication overuse. شافوا انه ما عنده هدك بس هو من ياخذ الانالجيزيا يصير عنده هدك بعد، او بعض الاحيان الانتنسيتي اوف ذا increase with the medication over. So medication now management هو family counseling. تقعد مع المريض explain to the patient that this is a problem from the point of view of